Hello there. I'm Dr. Srishti Mohapatra, and I'm one of the internal medicine consultant and aesthetic physician. And I also lead the research and development wing at India's biggest longevity and aesthetic clinic chain, the Wellness Co. Well, I have done my MD in internal medicine and I hold 3 masters, which is a fellowship from India in aesthetic medicine, and I'm in Harley Academy, UK. And along with that, I have a master's in injectables. I hold 2 AIs where I am one of the owners there and I lead those AIs. So, today we are going to talk about minimally invasive and non invasive techniques in inducing collagen and your body's own mechanism. We'll cover non invasive therapies like HIFU, therapy, and the little invasive ones, which is Morpheus and Dermapen. Today, we are also going to talk about patient selection, downtime, contraindications, results timeline, per session cost, the ROI. In this review, it is not just only for the business owners, it is also about the patients so they make smarter decisions and smarter selection of what exactly do they want. The ease of use, the tech breakdown, patient suitability, speed of results, training support, satisfaction, numbers on the costs, financing, profitability. So let's start. Let's talk about the non invasive part first. Let's talk about the therapy. The tech and the ease here is it creates micro focused ultrasound with visualization. Real time ultrasound imaging pinpoints the exact depth for precision of each and every practitioner. Touchscreen interface, of course, full new colored screen boosts more accuracy. You know where you're actually entering. The SMARS or maybe the dermal layers, everything is in front of you. Coming to the certification point for practitioners, generally a person who has been trained in therapy are more competent in 1 to 2 weeks within the certification. Now, the most ideal patient selection here is for mild to moderate facial or body laxity. That can include your jowls, brows, and neck in 30 to 60 seconds per line. Now, here the treatment is generally divided into lines, how big your face is, how much the laxity is, and what sort of skin type is yours. Generally, all therapy is done for all skin types 1 to 6. Not This therapy is not for severe sagging skin or thin skin. Now, let's talk about the downtime. Well, the downtime is none really. You can just have some tenderness or swelling within 1 to 2 days, which can reside down on its own. But the downtime is nothing on the surface, and it generally does not show up on your face apart from the redness. Now, the results are visible tightening, which you can generally appreciate in 2 to 3 months, and it peaks around for 4 to 6 months in 1 to 2 sessions per year, is what a patient would need. So, basically, one session is something which is 70 to 80% people are satisfied with by 9 months. And then for the second session, you can have a top up after 9 to 10 months. Now let's talk about the per session charge that we have here. The per session charge here can go around somewhere around from £500 to £1,000, which varies from one clinic to another, and your location of the clinic as well, where you're actually practicing. Now, talking about from business point of view of acquiring this machine. So the financing via the distributors has high margins, 70 to 80%. Ease and precision of the doctor and the practitioner. Generally, the tech and the ease is really simple. The real time ultrasound imaging pinpoints the exact depth for precision. Touchscreen interface, new full color screen boosts the accuracy. New practitioners are generally competent within 1 to 2 weeks with certification. Now, let's talk about the kind of work that therapy generally does. Whenever we are going to put one line of therapy into any area of the skin after marking, we are putting that energy for denaturating the existing collagen, which is creating a laxity on the face by inducing new collagen, which is also known as neocollagenesis. And whenever the new collagen is formed, it makes your face tighter and it creates a better jawline and enhancement in your facial features as compared to other techniques, which is not that precise. Of course, according to clinic owners, it is going to be a huge investment. But again, the kind of results that we are expecting with this machine is brilliant because it is a one off treatment or maximum 2 treatments per year, after which the patient is left satisfied within next 3 to 6 months after having this treatment. Now, let's talk about who's the best patient to be going for the L therapy prime. People with moderate to mild laxity of this. of their face, somebody who wants an enhanced jawline, reduction in their fat layer, and has to have a better skin texture with new collagen induced are the patients who should be going for Ultherapy Prime. All right, so we need to know who is an ideal patient, which we talked about, and who is not an ideal patient. A patient who's pregnant, has epilepsy, should be avoiding this. Apart from the patients who are actually diabetic and hypertensive, can actually go for this therapy because it is non invasive and the healing is faster than any other invasive treatment. Now, people who have pacemakers should not be indicated this therapy. So, overall, when we talk about this entire thing, All therapy, in my vision, is one of the most precise machines, and real time ultrasound imaging is something which is very pivotal for practitioners and clinicians to make precise decisions and also deliver precise lines and shots, which also leads for all of us to reach the exact layers of SMAS and dermis. So, therapy, of course, it is going to be expensive, but you can generally get the return of investment from these patients who are from 150 to 250 patients. And after that, it's all a profit for most of them. So, therapy is generally something which is one of the most pioneering machines and products for regenerative aesthetics. The best part about therapy is it is one of the only technologies and very few technology which is doing a real time visualization into your SMAS and deep dermal layers. It is also going to affect your fat layers near your jowls and your entire chin area, where you can actually work with precision. No other machine is actually showing any real time visualization. So that is where precision medicine comes into play. So, therapy to any owner, even if it is going to be an expensive bet, is something which each and every clinic, which is in a ground to actually put more money into it, should be acquiring. So, one of the most uninvasive treatment, which is not going to put on and poke on needles into your face without scalpels and has been in the market for quite a few time, is high intensity focused ultrasound, which is also known as HIFU. Now, coming to the tech and ease, it is very much similar to how therapy works, but there is no visualization. So it is all manual and all according to the precision that the clinician has. It can target areas even on the belly fat and laxity, but it would require more sessions. It totally relies on the transducer mapping and how you're going to scale up using your white pen on the skin. And the training here generally is required within 1 week. The person or the practitioner who's doing HIFU can get trained within a week as compared to what we were talking about in therapy. The contraindications again here remains that people who are epileptic, are more than 4 drugs for psychiatric issues, or people who have a pacemaker at their heart or have any active infection on their face should be avoiding that. Now, which patient should actually go for therapy? Again, moderate to mild laxity of the skin, and also people who want lift around their jawlines are the people who should be going for HIFU. The results generally start to peak up within 1 to 3 months and they show up on your skin. Generally, the results peak up by 6 months, but patients generally need 2 to 3 sessions per year to maintain those results. This works through neocollagenesis, that is, denaturing the original collagen which was already present in the face and then creating new collagen into your face. Right. So the per session charge can go up to varied across 250 pounds to 500 pounds, depending upon where your clinic is, where you're practicing. And generally, to acquire this machine, you would have to spend somewhere around 50,000 to 60,000 pounds. The return of investment generally returns here quickly, which is 150 to 200 patients, and which can be done within 3 to 6 months of an active clinic, which is running nice. Now, from a patient's viewpoint, therapy is something in comparison to HIFU more comfortable because there is more precision. So there are not more shots to it. HIFU works on shot basis, how many shots you're actually delivering on the patient's face. HIFU is somewhere affordable. You can have more patients coming back to you time and again within 3 to 6 months when they need more results and neocollagenesis as compared to the other machines in the market. So overall, when we talk about HIFU, it is one of the great purchases if you want to start somebody who's a beginner or if you want to start low or somebody who's a bit not easy on your pocket. And if somebody who's on a budget but still wants that amazing lift, you should go for HIFU. And HIFU, again, it's technically very safe. A lot of people can have that, apart from people on pacemakers, epilepsy, pregnancy, or breastfeeding. And it has no needle. So, of course, hypertensive patients or people who are on thyroid medications or diabetes who have a little more healing time can go for this treatment for neocollagenesis and better results. So now we will be talking about minimally invasive treatments. The two of my top favorite ones are the Dermapen and the Morpheus 8. Let's go with the Dermapen first. So Dermapen is something which works on mechanical microneedling, which can go up to the depth from 0.25 to 3 millimeter. It creates microinjuries, triggering wound healing and collagen via creating growth factors and initiating them to come to the surface and start the repair work. Now, when you talk about the Dermapen, it has controlled punctures which release PDGF and TGF beta for fibroblast activation. Generally, it is situated and limited to the epidermal layer of the skin, and it works excellent for pigmentation, texture, and acne scars. So that is the kind of patients you would like to treat with Dermapen. And also, it is very cheap as compared to the other treatments, and it is generally a go-to for the beginner practitioners. What are the contraindications for Dermapen? That is active infection, keloids, or people who have been taking isotretinoin for less than 6 months. Those are the patients and people we avoid generally for microneedling. Okay. So, what would be the downtime? The downtime is generally redness that persists from 1 to 2 days. A lot of people generally have better looking face within a few hours. And then you can, of course, apply makeup on day two because the active injured part on the surface of your skin do not need more skincare or maybe more makeup seeping into your skin. Now, when we talk about results, the results are generally visible within 3 to 4 weeks. It can take up to 6 weeks as well. And the sessions required for this is 3 to 6 complete sessions to create that amazing texture, to let go of that acne scar, or to let go of that pigmentation because the fibroblast activity generally does take time. Now, per session cost here can generally be somewhere around 100 to 200 pounds, depending upon where you're practicing and where your clinics are located. Now, the business to acquire this is completely a game changer for people who are going to begin their careers. So, people who are going to acquire Dermapen, it is generally going to cost somewhere around 5,000 or maybe below that, along with a range of treatment areas and also the training, which is complementary for people who are owning a Dermapen. Now, when we talk about the cartridges, that is generally somewhere around 25 to 30 pounds per cartridge. And the return of investment on such patients, people who have a Dermapen, is 50 to 100 patients, which can generally be covered between 3 to 6 months, given that you have a nice footfall. Now, if I talk overall about Dermapen, it is excellent for beginners because generally people get trained within the first session and first patient and first few hours. So generally it would just take 1 to 2 days of using the Dermapen because it is really simple. It has a speed, it has a depth, and of course you just need to charge it out whenever it's used and you need to change the cartridge. That is all about it. And Dermapen, you can actually work with a lot of serums that you can penetrate down on the skin. Okay, so it is a multifaceted which you can use in a very, very cheap manner and create a nice revenue when you're starting off with very mild areas. But again, it is limited to epidermal layer. All right, let's talk about one of the minimally invasive techniques that's in and around the market and has taken the entire market by boom. Because again, it is something that can be used for almost every skin type. Apart from the skin type 6, of course, it can be used, but with caution because it has a chance of creating post inflammatory hyperpigmentation on those skin types. Well, we are talking about the game changer machine by InMode Morpheus 8. Okay, so when we talk about neocollagenesis and also triggering more fibroblast growth, that is how it goes with Morpheus. Of course, it's minimally invasive. The depth of the needle can vary across from 1.5 millimeter to 8 millimeter. That is the deepest that any machine is actually reaching. So, by reaching that layer, you're also targeting fat cells. So, how does this work? Morpheus, generally, the needles bypass the epidermis. There's also bipolar radiofrequency, which heats the collagen from 60 to 80 degrees Celsius for immediate contraction of type 3 and type 1 collagen remodeling. Okay. So let's see who are the patients who are actually very good for it. People with moderate laxity and more, but not exactly thin skin, and those who do not have diabetes and hypertension, because the healing time is going to be a bit more, can be using this machine. Morpheus, the mechanism of action generally lies that the needles go into the depth of 8 millimeter, and the radio frequency in that is a bipolar radio frequency that heats up the collagen type 1 and type 3 up to 60 to 80 degrees Celsius for immediate contraction and creating more fibroblast and neocollagenesis. Now, patient selection. The kind of patients that you would select would be from Fitzpatrick skin type 1 to 5, because there are chances of post inflammatory hyperpigmentation and during the healing process that can manifest. And people who want to have a nice jawline, who have fat and double chin, they can also benefit from Morpheus 8. And of course, the laxity is taken care by this. The downtime is a bit more here. You can see the downtime for more than 2 to 5 days, maybe, and you can go back to working within the third day or the second day. There's redness, there's erythema, and of course, there are pinpoint bleeding and microneedle punctures and the square box that you can actually see on your face. Now, people who are not fit for Morpheus are people who are on more than 2 medications for heart, especially on blood thinners, who are diabetics, not the borderline ones, but people above the HbA1c of 7, because the healing time is a bit slowed for them. People who have a D dimer of more time. So people with heart or maybe some hormonal healing issues should not be considered very well. They can go for something which is a bit less invasive, something like a derma pen, which is more in control of the depth. Of course, you can control your depth here as well, because the depth can go up to 8 millimeter, but you also have 1.5 to 3, and you can calibrate that on your screen, of course. The tech is amazing because you can see the frequency, you can see the depth of the needle, and it does not need multiple passes. Now, with multiple passes, I mean the microneedling generally takes 3 to 4 passes, where you go from a zigzag fashion, then on a hashtag fashion. Here, there's only 40 to 30% of overlap and maximum 50%, where you're puncturing each and every time. All right. So when do we see the results? The results here are generally fast. You can see the results with between 2 to 3 weeks, and you can, of course, return to your work, see more tightening. People are going to show up and say, "Wow, your skin looks great." And of course, the sessions required here are less than what we are expecting with a normal microneedling device. That is 3 to 4 sessions. Generally, a normal microneedling device would take up to 6 sessions to show how effective the treatment has been. And of course, we can see acne scars getting better, your fat going out and redistributing, getting denatured, your old collagen getting away, and new collagen starting to make up. So, this is how it generally works. Per session cost can be nearly about 300 to 600 pounds, depending upon the location and the area where you're practicing. The business to acquire this machine is generally 60,000 pounds to 80,000 pounds. And the ROI is generally from 100 to 200 patients within 9 to 18 months. Of course, it does take time because it is a bit expensive as compared to others which are there in market. But to be really honest about this, if I give an overview, this is one of the machines that goes into 8 millimeter depth. And that is why you can actually use it on lax skins, under your arms, under your abdomen, on your thighs, and that can redistribute the fat cells, and it can literally make the skin feeling tighter. So, when we are starting to conclude about Morpheus 8, this is something that can actually work for a lot of skin types apart from 6. We have to be a bit careful about that. But overall, when we get an idea about Morpheus 8, it can work on acne scars, it can work on laxity, it can work on redistributing the fat tissues as well, and also minimizing the look and the bulky look of the face. It can also show amazing results with pigmentation. So it is really one of the bread and butter, which also has radio frequency in it. And of course, patient selection is very important here. But Morpheus 8 has huge number of benefits, because what sets it apart is the 8 millimeter depth that no other machine in the market, apart from being having threads or maybe fillers, is achieving. So yeah, it's a go-to from my side. All right, so we have talked enough about various invasive and non invasive neocollagenesis and new treatments that actually induce collagen. But if you're a clinic owner and you're thinking to invest something for your clinic and creating better results for your patients, let's go on a head to head comparison that what might suit you. So, talking about the depth and the effect, if we talk about HIFU, the depth is generally 1.5 to 4.5 millimeter lift, and Ult therapy being one of the precision medicine devices, it can target your SMART layers and your fat layers while you're visualizing those layers. And for dermapen, when you say, it is generally working on the epidermal layer of the skin. Morpheus, on the other hand, shows you the depth going into 8 millimeter deep and also targeting the fat. Now we have talked about the depth. Let's talk about the downtime. How your patients are. Each and every clinic owner knows that what kind of patients are walking into their clinic. So the downtime with HIFU is generally 1 to 3 days. With UL therapy, generally in my practice, that's 1 day or maybe I've seen none. And with Dermapen, of course, it's 1 to 3 days, but with Morpheus, it is 2 to 5 days. Now, coming about the number of sessions that generally a person needs, with HIFU, generally a person would need 3 to 4 sessions per year, depending upon the kind of laxity they are facing and the kind of effects that they are wanting. With UL therapy, generally 70 to 80% people are satisfied with just one off session. That also means that international patients who are flying down into your clinic with your reputation can actually be sold and can actually have big and nice results with their entire lift of the skin. The top up can be the second session after 9 months. When we talk about Dermapen, of course, we need at least 6 sessions to see that best results. So, 4 to 6 sessions is what we are looking at. And when it comes to Morpheus, 3 to 4 sessions is amazingly going to give you that entire snatched look and take away that fat bolus out of your face or your body. Now, coming upon the cost per session. Generally, for HIFU, I've seen the costs going up per session is £250 to £600, varying upon where your clinic is. For all therapy, it is quite expensive. It can go around from £500 to £600 to almost £1,000 and whatever you rate that as. Okay. And of course, it also depends upon the calculation of lines for all therapy and calculation of shots for HIFU. For Dermapen, of course, the budget is really nice and cheap for somebody who's looking for a quick fix and is also willing to put on more sessions to their work. It is £100 to £200 per session. And for Morpheus 8, it is generally £300 to £600 per session. Now, the machine cost that we were talking about in comparison to each other, a HIFU machine can be costing around £50,000 to £60,000. And whereas a Al therapy machine being the most expensive, now we talk about Dermapen, the cost of acquiring a Dermapen is less than £5,000. And when we talk about Morpheus, it can go anywhere between £60,000 to £80,000. Now, the return of investments of patients, generally for a HIFU machine, the return of investment is generally back with 100 to 150 patients. With UL therapy, it is a bit more, of course, with the expensive treatment that we are having, the cost of cartridges that we have, it is 150 to 250 patients. For Dermapen, it is generally 50 to 100 patients, and you're happy with that. And with Morpheus, it is 100 to 200 patients again, because it is having a good competitive bottleneck cheap out that is with UL therapy. So, final verdict for the clinics. Anybody who is afraid of needles or scalpels, you know that HIFU and UL therapy is their go to. For high end clients who have lack of time, would only like to visit when they need some maintenance, UL therapy is the best. UL therapy prime wins for the premium clinics. Superior visualization, patient satisfaction, word of mouth, despite higher upfront cartridge costs. HIFU is good for high volume and high turnover and faster ROI. So for me, out of both of them, UL therapy is a winner. Now coming to the invasive part, where people are happy putting small micropunctures into their skin and also seeping in more serums or actives into their skin and tightening their skin using radiofrequency. Of course, Morpheus 8 would dominate the market any given time because it is not just working on acne scars, pigmentation, or laxity. It is also redistributing the fat, which is also very nice for somebody. going for an abdominal tightening or underarm tightening or thigh tightening. So it is deeper and more versatile. Dermapen, on the other hand, is more entry level for textures and starters. It can also be used in salons, but Morpheus needs more practice of a practitioner and precision. And it gives amazing results within 3 to 4 sessions. So for me, there had to be a tie for the overall best, which is the Alt Therapy Prime and the Morpheus. But for somebody who knows that as a clinic owner, we have a lot to be treating. It has to be pigmentation, acne scars, laxity, fat. So, of course, I would go for Morpheus 8 as the winner in versatility, longevity, aesthetic chains, like each and every clinic has. Pair it with Alt Therapy Prime for full stack offerings. Train the staff well because excellence drives 80% repeat business. So, if you have any questions or if you want more comparisons from a point of view of a clinic owner or somebody who wants to invest, or if somebody who's a patient and wants to know what are the available options in the market, this is your go to. And stay tuned for more because we are going to discuss anything and everything about regenerative medicine, aesthetic medicine, dermatology, and longevity medicine. So keep following our space for more and let's talk about more questions and more answers there.